Welcome to the Dental Plan Benefits Overview for Blue Valley School District employees for the upcoming 2023 plan year. Delta Dental of Kansas will continue to administer dental plan benefits to Blue Valley School District employees. Blue Valley School District will continue to offer benefit-eligible employees 2 dental plans to choose from. In this presentation, we will detail the 2 plans referred to as the base plan option and the buy-up plan option. Both the base plan option and the buy-up plan offer benefits within the Delta Dental PPO and the Delta Dental Premier Network. However, both of the plans offer higher coverages for services when a PPO dentist is seen. You can search for a provider on our website, which is deltadentalks.com, using the Search for a Dentist feature from the homepage. This slide details the benefits available under the base plan option. Under the base plan, members can utilize a dentist within either the Delta Dental PPO or the Delta Dental Premier Network, but it is important to note that you will receive a higher coinsurance benefit under the plan if you utilize a PPO dentist. The annual maximum on the base plan is $1,500 per person per calendar year. The deductible on this plan is $50 per person, not to exceed $150 for a family unit. Dependent children are eligible for benefits on the base plan through the end of the year in which they turn 26. And the orthodontic or braces benefit under the base plan is a $1,000 lifetime max, and that orthodontic benefit is for dependent children under the age of 19. Under the base plan, diagnostic and preventive services are covered at 100% if a Delta Dental PPO dentist is seen. This includes cleanings, exams, and x-rays. And for dependent children, sealants and fluoride fall into that category. Basic services, which are going to be your fillings, emergency examinations, any oral surgery, endodontics, and periodontics, which are endodontics, root canals, and periodontics treatment of the gums, are covered at 80% if a PPO dentist is seen. And then major services, which includes crowns, bridges, dentures, occlusal, or mouth guards, are covered at 50% if a PPO dentist is utilized. And then orthodontics or braces are covered at 50% as well for dependent children that are age 19 and under. Please do note that major services and orthodontic services are subject to a 12-month waiting period prior to a benefit being paid on any services that fall into one of those 2 categories. And also worth noting is that the coinsurance levels seen here are for services received by a Delta Dental PPO dentist. If a Delta Dental Premier dentist is seen, those coinsurance levels do change to a 90-50-40 arrangement rather than 180-50. So diagnostic and preventive is covered at 90%, basic would be covered at 50%, major services would be covered at 40%, and then the orthodontic benefit does remain at 50% regardless of whether a PPO or Premier provider is seen. The next couple of slides will detail the benefits available under the buy-up plan option. There are some plan enhancements on the buy-up plan in comparison to the base plan that we just reviewed. These plan variances will want to be taken into consideration when deciding which dental plan to enroll in for the upcoming 2022 plan year. The provider network options are the same on the buy-up plan as they were on the base plan, with the higher coinsurance levels available if a PPO dentist is seen. The annual maximum benefit is one of the enhanced options on the buy-up plan. The annual maximum on this plan is $1,700 per person per calendar year, in comparison to the $1,500 annual maximum benefit that we reviewed on the base plan. The deductible is the same on the buy-up plan, $50 per person, not to exceed $150 for family. And the eligible dependent child age is the same as well. Dependent children are covered through the end of the year in which they turn 26. The orthodontic lifetime maximum is the second enhanced benefit that we're discussing under the buy-up plan. Ortho benefit on this plan is $1,500, whereas on the base plan it was $1,000. The next slide, we will detail some of the other enhancements that fall into the orthodontic benefit, but it is important to note that it does increase to $1,500 lifetime orthodontic maximum on the buy-up plan. With regards to the coinsurance levels on the buy-up plan, you'll notice that they are the same coinsurance levels, the 180, 50, 50 that we saw on the base plan. However, there are a few nuances to note that make the buy-up plan a little bit more enhanced with regards to the benefits and how they would be covered within those coinsurance levels. So your diagnostic and preventive services still includes the same procedures, cleanings, exams, and x-rays. However, the diagnostic and preventive services on the buy-up plan are not subject to the deductible or the annual maximum. On the base plan, they're not subject to the deductible, but they are subject to the annual maximum. On the buy-up plan, by not having those services subject to the annual maximum, that $1,700 that we referenced on the prior slide, you're having more money available to utilize for your basic major services throughout the course of the year, because no money will be pulled out of that $1,700 annual maximum for any services that fall into the diagnostic and preventive category. Your basic services are the same as far as the procedures covered there at 80%, and then major services, same thing there, same services, crowns, bridges, dentures, occlusal guards, implants also fall into major services on both plan options, covered at 50%. And then the orthodontic benefit, in addition to being an enhanced orthodontic lifetime maximum of $1,500, there is also a benefit for adults, an orthodontic benefit for adults as well as dependent children on the buy-up plan. So on the buy-up plan, really anyone enrolled, adults, spouses, dependent children through 26 are eligible for coverage if an orthodontic treatment or braces treatment plan is necessary, covered at 50%. The 12-month waiting period for major services and orthodontic services does still apply to the buy-up plan. The next couple of slides will detail two plan enhancements that are currently offered on both the base and the buy-up plans. The first program that we'll detail is the Right Start for Kids program. This program allows dependent children 12 and under to receive all services with the exclusion of orthodontics or braces covered at 100%. So that would mean anything that falls under basic or major services would be covered at 100% rather than a varying coinsurance level of 80 or 50 or what have you. All services with the exclusion of ortho for dependent children 12 and under would be covered at 100% as long as the dependent was seen by an in-network dentist. It can be a Delta Dental PPO or a Delta Dental Premier dentist, but members do have to utilize an in-network dentist in order to receive the benefits under the Right Start for Kids program. Under Right Start for Kids, the plan's deductible and the waiting periods do not apply. So any services that would fall under major are not subject to the 12-month waiting period, and the $50 deductible does not need to be paid out on any claims that are falling into the Right Start for Kids program. Covered services under Right Start for Kids are subject to the annual maximum. So on the base plan, the $1,500 annual maximum does still apply, and on the buy-up plan option, the $1,700 annual maximum does also apply. The other enhancement program currently offered on both the base and buy-up plan is the Unlimited Cleanings program. This program removes the frequency limitation that is currently in place on the existing benefit plan, which states that 2 cleanings will be covered during the calendar year or the benefit period. The Unlimited Cleanings program allows all enrolled members and their dependents to receive as many cleanings as deemed appropriate by the member's dental provider during the course of the plan year. Please note that all other frequency limitations for covered services under the plan do still apply. The unlimited cleanings program is only applicable to the cleaning codes that you see on the screen, 1110s, which are adult cleanings, 1120, which are children cleanings, and then 4910, which is a cleaning for members that are currently in periodontal treatment or periodontal maintenance. Also, please note that under the base plan, cleanings are subject to the plan's annual maximum. So any cleanings that are received will be reduced from the annual maximum amount, the $1,500 max on the base plan. But on the buy-up plan, since diagnostic and preventive services do not count towards the annual maximum, we would not be reducing the annual maximum on the buy-up plan only for cleanings that are received under that plan. And lastly, we'll highlight a couple member tools available for enrolled members to utilize with regards to their dental plan benefits. Members are able to access their online member account through our homepage, deltadentalks.com/member. Once logged in to their member account, members are able to view and print their ID cards, view all EOBs and claims information for themselves and any enrolled dependents they may have on the plan. They can opt in to receive electronic EOBs and electronic communications, as well as utilize some cost estimating features where you can plug in a procedure you know you may be needing to have, and it'll give you the estimated out-of-pocket expense that you would be subject to for that specific procedure. Delta Dental does also have a mobile app available to both Apple and Android users that members can download and have their ID card accessible on their phone, as well as all of the other functionality that's available through the online member account. All of that functionality is also available through the mobile app as well, searching for a dentist, utilizing the care cost estimator tool, and so on. And lastly, thank you for taking time to review the dental plan benefits that are available to Blue Valley School District employees for the upcoming 2023 plan year.